Peptides are being sold as the next miracle for hair loss. But can they actually regrow your hair? Or are you just buying an expensive scalp serum? Copper peptides, growth peptides, gray hair peptides, even injectable peptides, promoted online as a shortcut to thicker hair. The claims are impressive, but the science is much more complicated. I'm Dr. Ko, a hair transplant surgeon, and today I'll explain which hair peptides are interesting, which ones are overhyped, and which ones you should probably stay away from. Let's start with the basics. Peptides are short chains of amino acids. Think of amino acids as individual letters. Peptides are words made from those letters, and proteins are the complete sentences. Inside the body, some peptides work like biological messages. They can tell cells to repair tissue, reduce inflammation, produce certain proteins, or change their behavior. That is why peptides sound so promising for hair loss. In theory, certain peptides may support dermal papilla cells, which help regulate the hair growth cycle. They may also improve the environment around the follicle, reduce inflammation, support blood vessel formation, or help hair remain in the growing phase longer. But here is the important distinction. A biologically interesting mechanism is not the same as proven hair regrowth in humans. The best known hair peptide is probably GHK-Cu, also called a copper peptide. GHK-Cu occurs naturally in the human body and has been studied for tissue repair, inflammation, collagen production, and wound healing. Laboratory research has also shown that copper peptide complexes can stimulate human dermal papilla cells and may help hair follicles grow under experimental conditions. That sounds impressive. However, most of the evidence comes from laboratory studies, small studies, or products containing multiple active ingredients. We still do not have the same level of large, well-controlled human evidence that we have for treatments such as minoxidil and finasteride. So, could a topical copper peptide serum support scalp health or weak, miniaturizing follicles? Possibly. Could it reliably reverse advanced genetic hair loss by itself? Probably not. A peptide cannot simply create a new follicle where the follicle has already disappeared. You may also see ingredients such as biotinoyl, tripeptide 1, acetyl tetrapeptide 3, or different keratin peptides. These are often promoted as ingredients that strengthen the hair, improve follicle anchoring, reduce breakage, or support the growth phase. Some of these mechanisms are reasonable. The problem is that they are usually studied as part of a combination formula containing caffeine, botanical extracts, vitamins, or other cosmetic ingredients. Therefore, when the product appears to work, we often cannot tell how much of the result came from the peptide itself. Some peptides are marketed as treatments for gray or white hair. They are designed to influence melanocytes, the cells responsible for producing hair pigment. Theoretically, they may support pigmentation in follicles that still have some functioning pigment cells. But once a follicle has completely lost its ability to produce pigment, bringing that color back becomes much more difficult. At this point, peptide treatments cannot reliably turn fully white hair permanently black again. Products such as TB500 and other so-called research peptides are promoted for healing, muscle growth, anti-aging, and sometimes hair regrowth. Many have little or no reliable human safety data for cosmetic hair loss treatment. Products sold as research use only may also have problems with purity, dosing, contamination, and quality control. Do not inject an experimental chemical because an influencer said it made their hair thicker. Your scalp is not a chemistry experiment. Here is my honest verdict. Topical peptides are not completely useless. Some may improve the scalp environment, reduce breakage, support existing follicles, or work as an additional treatment, but they should be viewed as supporting actors, not the main character. For genetic hair loss, the foundation is still diagnosing the cause early and using treatments with stronger human evidence, such as minoxidil, finasteride, or dutasteride when medically appropriate, and hair transplantation when follicles have already been permanently lost. Because in hair loss, good science usually sounds less exciting than marketing, but it is much more likely to protect your hair.